Just while we're getting set up, I remember Doug quite well when I first came here as a county councillor. He was chair of corporate services all through that Site 41 era. And, you know, I can remember different time. The room was configured differently and the chairs used to present to county council. They'd come up to the podium. He'd bring his computer up, but it was before we used microphones. You'd stand up to talk. And he would pace up and down the aisle as he was taking questions, and he knew the agenda by heart. He didn't have to go back to his computer. He'd be talking, and if the crowd got unruly, I remember he turned to Tony George and said, just a minute, I need to talk to this crowd. And he went out to the end of the hall and addressed the crowd and silenced him. He was a wonderful man and a very strong chair and highly respected here at County Council, so he will be missed. So with that, I will turn it over to Jonathan for roll call, please.
Thank you, Warden. We have all members in attendance with a few exceptions. We have regrets from Councillor Dolan. We have regrets from Councillor Sondu with alternate Councillor Jonathan Scott in attendance, and regrets from Councillor Brian Smith with alternate Councillor Joe Belanger in attendance. And you have your quorum. Thank you, Warden.
Thank you. Is there anybody that has to leave early today? Not seeing any hands, so that should be good. So I'll look for the approval of the agenda. Councillor Measures. Front of me, I will just, but I will need that back. Should be.
Sorry, Your Worship, I've had to deal with some personal matters this morning, which made me a little bit late, so I apologize to the House. A call upon Councillor Dolan. So the resolution says that the agenda for the April 30th, 2024 meeting of the Council be approved.
Everybody's heard the motion. Questions on the agenda? Oh, mover and seconder yourself.
Mover and seconder? Yes, I suppose I can move it. And Councillor Fowler.
Thank you. Everybody's heard the motion. All in favor? That is carried. Thank you, Jonathan. Do I have a disclosure of pecuniary interest in any member of council? Not seeing any. If you find yourself in that situation later, please declare at that time. We have no presentations and deputations. Call upon Councillor Burkett for the consent. Yes.
Morning, Your Worship. Through you, moved by myself, second by Councillor Norcross, that the Council Communications and Proclamations April the 9th, 2024 to April 29th, 2024 have been given due consideration be received.
Okay, on that motion, everybody's heard the motion. I will point out that I did not make the Elmville Maple Syrup Festival this year, though it's in my agenda. I was actually planting a tree with Councillor Norcross down in New Tech that day, so I'll apologize. But I did open the floor for other teams to win the log sawing. We had the first and second place team were with me down in New Tech. I'll get you lads later, don't worry. So on that motion, any questions? Did I have a mover in a second? Yes, yes, you did. All in favor? That is carried. Thank you. So next I have the adoption of the council minutes. Deputy Warden Coghlan, please.
Thank you, Worship, and through yourself, although I don't know what I'm going to say during announcements now. Thank you. That the following moved by myself, seconded by Councillor Locks, that the following council minutes be confirmed and adopted, and Committee of the Whole reports confirmed. County Council minutes April 9th, 2024, and Committee of the Whole report April 9th, 2024.
Everybody's heard the motion on the minutes. Any business arising from the minutes? Not seeing any. All in favor? That is carried. Thank you. And presentations and considerations of the committee reports. Chair Cox.
Good morning, everyone. Moved by myself, seconded by Councillor Evans, that the performance management recommendations contained within the Committee of the Whole report dated April 9th, 2024 be approved.
Anything to be pulled from the performance? Not seeing any. All in favor? That is carried. Thank you. And now Human Services, Chair Leduc.
Yes, thank you, Warden. We're on to 9.2, Human Services. Moved by myself, seconded by Councillor McDonald, that the Human Services recommendations contained within the Committee of Whole report dated April 9, 2024 be approved.
Any to be pulled from Human Services? Not seeing any, so all in favor? That is carried. Thank you. I don't believe we had any corporate, did we?
That's correct.
There wasn't anything under corporate. So presentations and considering the special committee reports, we have the Governance Committee. So Deputy Warden.
Thank you, Worship. Moved by myself, seconded by Councillor Gordon, that the Governance Committee recommendations contained within the following Governance Committee reports dated April 16th, 2024 be approved. The Governance Committee of April 16th, 2024, and Governance Committee Confidential Report, April 16th, 2024.
Okay, any items to be pulled? Councillor Smith.
I'd like to pull 6.2 for discussion, please.
Thank you. So 6.2 is pulled. So on the remainder, as amended, any questions on the governance? All in favor? That is carried. Thank you. So 6.2, before I get a mover and a seconder, and thank you for pulling it, we want to have a light discussion on it. As you can see, we're scheduling a workshop to look at the structure of council again. So one, we wanted to make sure the House was okay with doing a workshop. The three items we've got so far is the composition for discussion, the compensation, as well as full-time warden. Those are the three issues that we've pulled for discussion at the open house. So I guess first I'll see, is there any other issues that the floor felt should be discussed at that open house? And then is there a need for an open house? So is there any other issues? I'll ask that first that individuals would like to see discussed. Okay. Councillor Fryer, yes.
Thank you, Warden, and not an issue. Will we be able, I was looking at the information and there's some other information I wouldn't mind having as I consider things moving forward. I'm fine with the three that have been pulled. And General Manager Wilcox isn't here today, so I'd like to know if we'd be able to get some information in regards to the total councillor compensation, not just for Simcoe County, but these other ones that we're looking at. I just think it's something that I'd like to have for information, and if that could be provided, and that would be great. And if we do think of other information that we'd like to see, we can just email in and ask.
Yes, Mark, that won't be a problem getting that information, correct?
Yeah, through your worship, yeah, we can include that information specifically in the agenda for that day for the workshop.
Yeah,
not a problem.
That would be great, and it's nothing specific. It's just food for thought.
Yeah, and yes, Jonathan, we can email Jonathan if we come up with any other suggestions. I encourage the workshop. It's something we look at every term, and it's something to good send back to the minister. Yes, we've looked at our compensation, we've discussed it, and whether it be status quo or changes, it's good faith that we take a look at it. We have every single term we take a look at it. Any other comments or concerns? So I have the original motion that item GOV. I moved it, or the deputy warden? Okay, I'll look for a mover, deputy warden, second by Councillor Fryer. That item GOV 2024-079 dated April 16, 2024 regarding council composition, history, and other governance consideration be received, and that a special meeting of the county council be convened to consider and workshop options for government reform. All in favor? That is carried. Thank you. Next, presentations and considerations of municipal services. So I've also got the Lake Simcoe Regional County minutes here. I'm looking for the motion. So it's moved by Councillor Norcross, second by Councillor Bell, that the minutes of the Lake Simcoe Regional Airport Board and confidential Lake Simcoe Regional Airport Board meeting held April 9th, 2024 be received. Any questions? Obviously not on the confidential portion. Any questions on the meeting? All in favor? That is carried. Thank you. We have no county officers report, no motions of which notice has been given. Do I have any notices of motion? Don't recall seeing any. Closed session, we have none. So announcements. First, I mean, unless you're living under a rock somewhere, you're quite aware of the great announcement which we had in New Tecumseh over the Honda plant last Thursday. That, you know, that's a $15 billion investment in Simcoe County. Can't say enough about how pleased we are to see that, and I'd be remiss if I didn't point out how well Councillor Norcross did on the stage with the Prime Minister and the Premier. It's a rare opportunity that you get to stand on stage with all three levels of government, and you spoke very well. Congratulations, and well done. So an absolute great news story for the county. Richard.
Thanks, Your Worship, and thanks for being there. I really appreciate it. It was a historic announcement. It was an honor to be on the stage. I really had a lot of fun doing it, actually. But anyhow, I digress about that. What I'd like to do, though, is I just want to thank this House, and I want to thank Simcoe County. I want to thank every single person in this room. We competed globally for this plant, and we were successful because of the relationships we have with other levels of government. And one thing that was quite obvious and quite clear was the relationship between New Tecumseh and the County of Simcoe, Province of Ontario, and the federal government. And that's why we were successful. So I'd like to thank every single member sitting in this House. It was your support, your collaboration that truly helped make this happen. We are greatly thankful, and we're keeping all the development charges for ourselves. Okay, thank you very much.
And I believe the Prime Minister mentioned now, with this build now, we will surpass China as a battery builder for lithium automotive industry, and that's the first time in a long time any country has surpassed China on production. So, again, once the shovels are in the ground, it's built. Any other announcements? Yes, Deputy Warden. Didn't steal all your thunder.
Some of it, but that's thank you, Your Worship. And through yourself, I just wanted to take the opportunity to thank everyone who came out this last weekend to support Springwater and our Maple Syrup Festival, and especially the county councillors who participated in our log sawing competition. And I would not be remiss in pointing out that our champions this year was Penetang Machine, who beat Tiny by 1 second. So it was quite the race, but congratulations and thank you.
Councillor Anderson.
Thank you, Your Worship. I just wanted to echo your comments earlier about former Councillor Doug Little and Deputy Mayor for the Township of Agitaus-Ranio. I also want to extend my appreciation to the county to have the flag lowered in memory of Doug. For those who didn't know Doug, as the warden indicated, he was quite the straight shooter and was a friend of the county and a friend of the many municipalities. He served 14 years as Deputy Mayor of the Township of Agitaus-Ranio and 14 years as County Councillor, and his service will not be forgotten. So thank you very much.
Councillor Fryer.
Thank you, Warden. This past weekend, another successful women's hockey tournament was held in Collingwood in conjunction with Wasaga Beach. In fact, the most successful ever for the Living Wish Foundation of South Georgian Bay, who have reached over 100 wishes granted. I heard from Director Carrie Plater that they are thrilled because it's such an important part of their funding. I wasn't able to attend until later after the official ceremonies, but yourself, Warden Clark, County Councillors Deputy Mayor Schnell, and Mayor Measures were on hand, and along with our Collingwood Councillor Steve Perry. I want to make important note of the fact that that tournament's held in memorial of Cal Patterson. And we all are well aware of the fact that Cal served a long time as councillor and mayor of Wasaga, and then, of course, as warden here at the county. And I just wanted to make special note of that.
I believe Cal was 5 years as warden, which it's got to be a record, because they were back in the one-year terms. So no, he was there 2-year terms in there as well? Yeah. So he was well respected. Thank you for that, Councillor Bell.
Sure. This past weekend, we actually held the Ontario Wrestling Federation Wrestling Championship or Provincials in Orillia. We had over 300 kids come, which is nice because after COVID, we had such a drop in numbers, and we're starting to see all the clubs come back up. We had a lot of kids in the county of Simcoe that did medal, which was nice to see. So it's great to see it coming back up in numbers.
Thank you. Councillor Cox.
I just thought I would mention this because Lynn isn't here today, Councillor Dolan. The OSIM conference is in Orillia from May 1st to May 3rd this week. Anybody who's already registered, looking forward to it. It looks like a very wonderful schedule, and I just thought I would mention that. Thank you.
Thank you for reminding everybody. Any other? Yes. Councillor, sorry, on.
Yeah, thank you. I just wanted to also thank the county for their support as Collingwood made its way through to be able to accept the lowest tendered bid finally on our expanded water plant, a plant that's being expanded in conjunction with New Tecumseh and will support lots of growth in New Tecumseh and ourselves and more. We have a plant that will grow in 2 phases with a final addition of the equivalent of 60,000 single-family homes. So you can relate that into multis or commercial or industrial, but huge expansion. And I just wanted to thank, I know we had some great support from senior staff here, so thank you.
Yes, right in the nick of time. I know Honda will be glad to hear that the expansion is going ahead. Councillor Van Staveren.
Thank you, Your Worship. I just want to invite everybody, if they're not doing too much this Saturday, we have a double-edged event in Stayner. It's the Stayner Kinsman Duck Race, which is becoming world famous. It's a great family event. But before that, I'd like to welcome everybody at 10:30 or beyond. We are having the grand opening of the renovation of our council chambers. So please, if you're coming through, you're welcome to come there first. And then if you want to go over to the Kinsman Park, there's going to be the duck races, which if you've never experienced, are a wonderful event. So just to put a little plug in for them. Thank you.
Thank you. Any other announcements? It's nice to see as COVID's ending, we're starting to see the festivals and the celebrations coming back. So with that, I will look for the confirmatory bylaw. Councillor Norcross.
Thank you, Your Worship. Moved by myself, seconded by Councillor Burkett. That bill number 7073-24 be enacted as a bylaw of the County of Simcoe.
On that bylaw, all in favor? That is carried. And now that the April 30th, 2024 meeting of County Council be adjourned at 9:20 a.m. Moved by Councillor Anderson, seconded by Councillor Greenlaw. All in favor? That is carried. So, well, Doug, I don't have you to bring our city reps in, can you?
Perhaps Councillor Smith.
If you could go and bring our city reps in, please, Councillor.
I don't remember anything on this. You set that on a long time, eh? Is it? Oh. Oh, God. Here we go.
Okay, Mr. Clerk, if we can take roll call again, I'll call the meeting to order.
Thank you, Warden. In addition to those in attendance at council, we're joined by city representatives, Aurelia Councillor Durnford, Aurelia Councillor Fallis, Aurelia Mayor McIsaac, Barrie Councillor Nagusi, Barrie Mayor Nuttall, Barrie Councillor Riepma, and Barrie Councillor Hamilton is absent. You have your quorum. Thank you.
Thank you and welcome this morning. So I'll look for the approval of the agenda with Councillor Measures, please.
Thank you very much, Your Worship. The resolution is for the agenda of the April 30th, 2024 meeting of the Committee of Whole be approved. Ask for a mover and seconder, Councillor Fryer, Councillor Michael Smith.
Everybody's heard the motion. Any questions on the agenda? All in favor? That is carried. Thank you. Do I have any pecuniary interest by any member of council? Well, if you find yourself in that situation later, please declare it at that time. Presentations and delegations, and we do have one this morning. I'd like to introduce Carmen Stumple, the President and CEO of the Aurelia Soldiers Memorial Hospital, here to provide a presentation on behalf of the Simcoe County Hospital Alliance. Great to see you again, Carmen. Come on down. Just whenever you're ready, sir.
Thank you, Your Worship, for the opportunity. Thank you to the Committee of the Whole for this opportunity to present. I'm Carmen Stumple, President and CEO at Soldiers, as well as the current chair of the Simcoe County Hospital Alliance. I'd like to take this opportunity to introduce the committee itself. We have first, no stranger to anyone here, General Manager Jane Sinclair for leading the group. We have Mike LaCroix from Collingwood General and Marine Hospital, Matthew Lawson from Georgian Bay General, Gail Hunt from RVH, our newest member, Dr. Paul Woods from Southlake. I'd like to acknowledge Jody Levac, who was the past chair of this alliance, who's recently retired, and here in his place is Bill Bai, and Dr. Nadia Sunderji from Waypoint. So together, this group is charged with supporting the health and well-being of our community, and after listening to the earlier session, apparently we have our next task to challenge the municipality of Penetanguishene at a log sawing contest. So, game on. So, this map represents how well served the county of Simcoe is by the hospitals in this area. Individually, we all support the local health and well-being of our respective communities. Collectively, we support a network, a system of acute care that ensures that patients have the services and supports they need. And you'll be hearing that a lot in this presentation. It is about collective impact based on partnership. And I'll start with some numbers, and this infographic really highlights that amount of collective impact. So on our left, we have the numbers from 2023 that were recently collected. We have surgical cases, cardiac cases, cancer treatments. We are talking tens of thousands of lives affected by the services, the interventions that exist within these acute care facilities. And that's supported in a regional format. We have local care, community care in the form of 63,000+ births. We have 360,000 plus emergency department visits. Those are core functions of community-based hospitals that are serving the urgent needs. Not only is it care delivery, but we are also employers, some of the largest employers in the county with over 12,000 employees, including almost 2,000 physicians, and we would be remiss without including our volunteers that work day in and day out. That translates, in this year, we surpassed $1 billion of salaries and wages, which means we are an economic driver in each and every one of our communities as well. So how do we achieve that collective impact? And I want to provide a few different views of how we partner. The first view of how we partner is between hospitals and how we work together as a system. In the bottom right, we share one example with you, our regional acute mental health services. We have many services where we as acute care hospitals work together to ensure that patients receive the care they need. In this circumstance, we have Soldiers, RVH, and Waypoint providing access to acute inpatient mental health for those individuals that require it, and we ensure that the entire county is well served by that. Our partnerships between hospitals don't end at at services and healthcare delivery. We partner for other reasons like research and innovation. We have an example here between Georgian Bay General and RVH of how research and innovation space was created to allow that collaboration and bringing together different groups to support research and innovation. We also have an example here from Southlake as well as Stevenson Memorial, where every hospital is looking at deploying electronic medical records. These are very large IT-based projects, and every hospital works with partners to deliver that, to create the systems that are both effective and efficient in terms of the resources we use. When we look beyond just how hospitals work together, and we describe that as horizontal integration across the hospital system, we are also emerging in our leadership role in vertical integration, which means hospitals working with all sectors in the healthcare continuum. And that includes acute care, primary care. We work with community support services, mental health services, housing, all of these which have a very strong municipal representation. And that's all achieved through the work we do in our Ontario health teams. So every hospital in the Alliance has work, is playing a leadership role in how we integrate care. At Soldiers, we're pleased to be one of the 12 accelerated Ontario health teams, so we're really looking at how we drive this innovative model in Ontario, working closely with not just the provincial government, but all levels of service. And we have participants in this room here that we work with closely. And some of the topics we're tackling are how we support individuals with chronic diseases navigate a very complex system, how we support transitions through different levels of service in health from hospital to home. And we're looking at how we can build capacity collectively in the system, because we know the healthcare needs of our communities are growing. Our communities are growing, the burden of illness is growing, and we need to be thinking smarter in how we integrate those services. And it's through this vertical integration across sectors that really supports that well. And an important partner in that vertical integration is the County of Simcoe. And there's a number of examples here. I'd like to touch on a few of how we work together in partnership with the county. The first, I would be remiss without acknowledging the dedicated offload nurse program. So this was a program that was originally established at RVH, and then more recently, Soldiers was added onto the list, and now other hospitals as well, Collingwood, Georgian Bay, and Stevenson Memorial. This is a program that allows for nursing 7 days a week, 12 hours a day during peak times to assist in the triage and offload of patients from the ambulance stretchers into the emergency departments. This improves quality of care, improves access time to care. It also improves the efficiencies because everyone wants to see the ambulances not on the roads and not in emergency departments. I'll share with you some data to reflect the profound impact those changes have made. And I know the funding has been recently made available through the province for this year, and we hope to continue that program going forwards. There are other opportunities of how we work with the county, and we're very grateful for that. We have outreach teams. We have teams that go and meet individuals where they're at, whether it's a mobile crisis response team working with hospitals in the OPP and how we respond to with individuals that are suffering from mental health. We have outreach into long-term care homes where we can avoid hospital visits, avoid emergency visits by partnering with long-term care homes such as the homes run by the county. We also have transport services. The code STEMI, which is ST elevation MI, which is a very big heart attack. We have transport systems in place to ensure they get directly to the right institution to get the services they need in that very acute setting. And there's more transport services, there's more of that outreach, all of that. All of those services allow us to work better, higher quality of care, higher efficiency of delivery. And how does this all come together? So we thought we would use an example and working with our colleagues to piece it all together of how we can support populations in much better ways through partnership. And we thought the mental health and addictions, it's something that's on the top of all of our minds, and we can witness how at all levels of partnership we are making a difference. We've mentioned how we partner within hospitals to ensure that everyone gets access to acute care services when they need them. Partnering with community, and a great example here is through the leadership of Waypoint. We have a Crisis Now opportunity where patients and individuals can be assessed, and we can treat within the community through outreach teams, crisis lines. We have beds that are not associated necessarily with hospitals to keep the people in the community where we think the best care could be served. And more recently, and this is within the last year, we've been working through a process to plan for acute care beds as a collective. So historically, every hospital does their master planning and isolation, and we all decide how many beds we need to grow planning into the future. We've decided to take a different approach this past year. We are looking at what does the region, what does the county need as beds, and how do we plan together that allows for more efficient use of beds, and it actually gives us the opportunity to make a proposal to the Ontario Health to ask for the services required so that all communities can be successful in working together to get access to the services they need. So I'm going to change gears a little bit here and share some of the statistics and some of the direct impact that we have been able to have with the County of Simcoe in the last year or so. This is the ambulance offload, and again, this has been such a transformative success for our organizations. Here's a series of bar graphs and line graphs going over time. The last bar graph is the first quarter of 2024. You will see over the years, the volumes of the green bars have been increasing. That is increasing numbers of ambulance transfers to hospitals. The last bar is only 1 quarter, so that's reflective of only 3 months. What you see in the lines, both the dark line and the red line, are the offload times, both the average and the 90th percentile. And what you see in 2023 is a shift. It was progressively getting worse until the offload program was instituted at all hospitals, and we've seen a dramatic decrease in offload times, both average and 90th percentile. And that is a trend. We know that the burden of disease out there, we know our emergency departments are becoming more acute with more individuals, and we're able to bend the curve downwards in terms of offload times, which means patients are being triaged faster and they're getting access to the care they need faster. This is a huge success. This is achieved by the offload nurse. It's also achieved by partnership. One of the things we're doing within this program is lean strategies on how we can become more efficient in the emergency department with the paramedics working together with the nurses and physicians and other support staff. So this is really bringing the teams together with the right resourcing, with the right staff to accelerate that offload and get patients the care they need. And lastly, I want to acknowledge and extend our gratitude on behalf of all the hospital CEOs around the county funding. And we thought we would highlight some of the impacts that have been made since in the last recent year or two with regards to some of the investments that were made due to the generosity of the county. And the themes here, one, diagnostic expensive, imaging is very expensive. X-rays, PET scanners. It is through the support of the county that we were able to acquire new equipment at a variety of hospitals across the county. Secondly, we're also really pleased to see that the redevelopment at Stevenson Memorial is moving forwards, and the money has been allocated there over the last year. So again, collectively, we are seeing major impact on very expensive but very necessary diagnostic equipment and facilities that are required at our hospitals, and for that we are all immensely grateful. So with that thank you, with that gratitude, I'll end the formal presentation. If you look in your packages, you will see highlights from the individual hospitals. We added it in the appendices for your viewing. You can look into your respective communities and see what's happening in others, but we thought we would focus on the collective work that's happening within the hospitals of the Simcoe County Hospital Alliance. And Your Worship, that is the end of the presentation. Happy to answer questions.
Thank you, Carmen. Do I have any questions or comments? Councillor Leduc.
Yes, thank you, Warden, and thank you, Carmen, for that presentation. Well done. It speaks volumes to what the Alliance does, and I want to thank everybody from the Alliance for being here today. Thank you, Dr. Woods, for joining the team. It is a tough time in healthcare right now, and we need to be as supportive as possible when it comes to healthcare. I can tell you this weekend we just had our Walk for Southlake. It was well supported there, and the fundraising goals hopefully were being met. Council, we do a great job of supporting our Alliance, but I tell you that we need to continue, because as we're growing county, our healthcare systems have to grow with it, and all our hospitals are under pressure to service our residents. And as you can see from some of the numbers that was presented in this presentation, they do a great job with the resources they have. So I want to thank you for doing this, and thank all of you for being here today, and appreciate you being here and seeing with us. So thank you very much.
Thank you, and well said, Councillor. Councillor Fallis.
Thanks, through the chair. Just wanted to echo Mayor Leduc's sentiments there. Great job to Carmen for the extensive presentation, and really drove home this notion that hospitals and this group is the lifeblood of our community. My big question to Carmen was, what do you think the biggest challenge is facing our hospital network over the next 10, 20 years? Specifically, are there certain things that our county should be really turning our minds to? Thanks.
Carmen.
Yep. Through the chair, through the warden. Later this week, all of our colleagues will be attending a session hosted by the Ontario Hospital Association, and we will be receiving information with experts at the University of Toronto that has been forecasting healthcare needs into the next 20, 25 years. I had the opportunity to talk to the president of the Ontario Hospital Association, and he was receiving a sneak peek of what those results are. And the word that was texted to him was terrifying. So I think the burden of health and illness, the burden of illness in our communities over the next 20 years is going to grow. Our communities are growing, and the burden of illness per member of the community is growing as we are aging. And when you look at the demographics and you superimpose all the successes of modern technology and health, means we're treating more people for longer. And it's the multiplier effect of multiple comorbidities at the same time and navigating those very complex cases. That is what is our biggest challenge, is managing the health needs. And that is why we are investing at all levels in terms of our energy, both in the community, in the hospitals, but we are not well positioned to keep pace with growth. And I think that would be our number one challenge going forwards. Thank you.
Okay, Councillor Fryer.
Thank you, Warden, and thank you for the presentation. Excellent to get an update. Specific to Collingwood and to Collingwood General Marine Hospital, the update and the priorities that are covered here. Really appreciate that information as well. I'll make sure to share it with our council members. We're always interested, but I remember during campaign this term, the MRI was a big discussion topic about the need for it, and I'm so pleased for the hospital to be able to be working on the implementation of that. And then, of course, we have the development that we're hoping will come through. And so, again, thank you for the detailed information and for everything you do for our communities. Thank you.
Okay, Councillor Van Stavern.
Thank you, Mr. Warden. Carmen, quick question. Can you speak a bit about the mental health outreach? And what I'm looking for our region, you talked about the OPP. In our community of Clearview, in a lot of cases, the first responders, the people see, are the police officers. I know we do have a couple dedicated mental health officers within our community. However, it concerns me that we've not invited or opened the doors of our high schools to a lot of this prevention. Are you pushing back at all? And I can extend it beyond even high schools. I can say colleges and universities. Prevention's the best thing for keeping people out of the health system. Can you speak about the outreach that could be done or is being done about that, please? Thank you.
Go ahead, Carmen.
Thank you. It's a great question in terms of how do we move upstream, we described, in terms of our preventative techniques. And yes, whether it's mental health, many of the mental health disorders start at a very early age, and that is the opportunity to prevent and avert a lifetime of serious chronic disease. Where I see that occurring is within the Ontario health teams. That group, it includes public health. There is a strong public health component to understanding population health, understanding the determinants of health. As we know, it's not just the illness, it's all the factors that affect the illness. Healthcare contributes about 25% of the wellness of a community. Postal code, food security, addictions, many other aspects have such a large bearing on how youth will succeed or not. So we see that opportunity, hospital being a very important partner, but there's very limited we can do on our own. The outreach is still pretty reactive. It's a great program because it's getting to people and it's creating different pathways that aren't just law enforcement, and it's not just the emergency department. It's creating new pathways to community services and getting access to people directly to the supports they need. Backing that up, it is a preventative measure that has to be done in partnership with municipalities, with public health, and with the education system. And I think there's a great opportunity there and something we need to tap into. We are still struggling with managing the risks that are arriving at the door, and we're somewhat focused on that right now, but there is a real intent to move that upstream.
I agree. Some of my participation in meetings about that, there's been a lot of pushback to say we're not welcome in the schools. Well, the time has come. We got to push back and say no. The kids need us in the schools, and young adults, whatever you want. I think we have to push it a bit. That's all. Thank you.
Well, we will work with. That will be definitely the approach we take in Ontario Health Teams, is bringing people into work together.
Okay, Councillor Norcross.
Thanks, Your Worship. Through you to Carmen. Just going to revert back to the first question. I think what the honest answer there is, it's coming down to funding as we continue to grow up here and our population explodes. Is the provincial government keeping up with the funding that's required, or do we have to go out to our community? Kind of an obvious question here, but I like to get Carmen's thing on it. The community share seems to get bigger and bigger, and there's only so much money at that well that we can go to. Do you have any plans to go forward on a funding model or changes to the funding model on how do we provide these services?
So we did present this year on the funding model itself, and just a reminder to all councillors, it is typically what happens in capital build. For the infrastructure for the bricks and mortar, it's a 90-10 split, where the province pays 90 and the local share is 10%. And then for the equipment within, that is 100% local share, and that's a partnership between hospitals, foundations, community, et cetera, and municipalities. So that formula has not changed in the last little while. What has changed in the last bit is cost escalation. So not only are we growing faster, and we may need more, and projections are growing higher. If you look at the difference in projections between the 2016 census and the 2021 census, it's dramatic increase, a sharp increase for this county. So we're seeing growth there and exponential growth in cost. So I think I could speak for all of us that we all struggle with the local share because of the escalation. And the approach, there is discussions. I can't report any actions in terms of the funding formula. There's also discussions on how we can better bend the curve in terms of working together. And that example we shared with the mental health is trying to bend the curve by projecting as a county instead of individual hospitals. We can probably have some gains with critical mass.
Okay. Alternate Councillor Blanchet.
Through the chair, I just want to also commend you on your patient customer service. I've had a number of friends, myself, my spouse, have required your services, and it doesn't happen by accident. The training and culture that you're trying to create within your facilities, that I haven't been in all of them, but we're in several, and I commend you for that. Thank you.
Thank you.
Councillor Snell.
Thank you, Warden. Through you, just to sort of circle back to the subject around youth mental health. We know that obviously COVID, the pandemic, the outcomes of that have impacted a lot of demographics, mental health, but youth in particular. Because you're starting to strategize or focusing as a county, as a region, are you partnering with our local school boards that can also provide real-time data in terms of what they're seeing on the front lines? And also too, in regards to New Path, that is a great regional service that also serves as an initial intake, preventative mental health support for families and youth. And also, how would that incorporate with your family health teams, as those are obviously one of the frontline folks as well, please?
Carmen.
Thank you. I will start by saying we're very fortunate to have the expertise we have in mental health. We have a specialized center in Waypoint that is partners, and that's been recognized by Ontario Health through the creation of the Mental Health Center of Excellence. So it's a provincial body that oversees how we're developing, or regional for a fairly large portion of the province, how we develop services, including the child and adolescent mental health services that are so desperately needed. So yes, there are partnerships with multi-sectors within the region. So Ontario Health does bring in sectors outside of health to support community services, et cetera. And in partnership, we are exploring how our mental health specialty services get embedded in each and every Ontario Health team, so that great mental health starts at primary care. It starts with social determinants, and you have an entire spectrum of services of varying degrees of complexity. And we need to make sure that that is navigated effectively across all of those services. So whether the primary Care teams have access to structured psychotherapy, which is something they can deliver within a local community, or if you need more specialized services, how that access is achieved. So that navigation is critical. It's done in partnership, and it's a big task. It's a big area, and we typically start with in the more acute area and work upstream and see how we can prevent some of those cases from actually occurring. So I know the work is underway. It's been well recognized post-pandemic that that is a need for attention, and it is getting it from all levels of government, federal and provincial, as well as municipal. We will continue to do that, and it's a priority for a lot of the Ontario health teams. Thank you.
Follow up, go ahead.
Thank you for the follow-up. I'm so glad to hear that, because the mental health system in particular can be a real meat grinder for parents, and in terms of navigating it and figuring out the different steps, especially if you don't have the fortune of personal benefits and you're having to use publicly funded services and supports. So definitely any great communication that can go forward to sort of connect the dots for a parent, I think, and caregiver would be so incredibly appreciated. Thank you.
Okay, thank you. Any other? Oh, yes, at the back. Councillor Hamilton. Welcome.
Thank you, and through you, Warden. Thank you for the presentation. It's nice to hear the level of coordination amongst the hospitals in our regions. We appreciate that, and the work of the OHT as well. I just wonder your thoughts on the future of governance over the next 5 years, decade, and in collaborative governance specifically. I think right now we've got hundreds of little boards in terms of mental health and addictions, community services, primary care. You've got all the boards at the hospital. All have different priorities, different strategic plans, different outcomes, different accountabilities. I'd like to hear this year that the hospitals did sort of get together and look at joint priorities. But the way forward, do you think there's opportunity for more collaborative governance, integrative governance, where the boards throughout the region are coming together, maybe through mergers, but more in an integrative fashion to actually look at the health needs of our community, right from prevention to the acute needs as well, and really coming up with joint accountabilities and joint outcomes. So just your thoughts on how you think governance needs to evolve to avoid the terrifying future that you've identified.
Carmen, easy one for you.
I was just going to say, how much time do I have for that question? I'll answer it a couple of different ways. The early days of Ontario health teams were all structured under what's described as a collaborative decision-making agreement. So it wasn't a formal structure, it wasn't legally binding, but incredibly successful, and we had the ability to run programs of multi-million dollars through this collaborative decision-making agreement, getting services to the right places. And that's true for the Couchiching Ontario Health Team, but true of other Ontario health teams as well. So that is evolving as we speak. So we are literally waiting for the regulations to the act that will define the governance model for the future of Ontario health teams. What we can see coming is not forced mergers. That is not going to be, from what I understand, in the cards, but a governance model for the Ontario health teams that brings together the different sectors and the skills related to the different sectors, like primary care, like a patient and family member that need to be part of that governance, as well as the different organizations, and the likely mechanism of which that will be managed through funding, to say the deliverables will be attached to funding mechanisms. And that is, I would anticipate that the majority of funding going forward would be in an integrated fashion, so that you have to deliver the integrated results to continue to get the funding for new programming going forward. So I don't think it was ever intended, at least my understanding, to force. There's still opportunity for voluntary, and we see a little bit of that happening. But I think the real value is that creating that shared purpose that people are working towards based on the populations that need the service. And if we can do that well, then the governance will follow.
Follow up, go ahead.
Just to follow up, if I may, I think the comment of the integrated funding envelope is absolutely key, and I agree forcing mergers is probably not going to be helpful or productive, but I do hope there's a willingness to look at mergers where they make sense, especially in the community. And just, I'm going to throw this out there, I caution a little bit about the OHT. I'm watching it closely, and I do see the value of it. I worry about creating another bureaucratic structure where we're hiring another CEO, another staff on the OHT. So we spend a ton of money in healthcare, and I really think it's about looking at how do we utilize utilize that funding most effectively, most efficiently, make sure it gets to where it needs to go. And I think that, integrated funding envelope is the way to go. So thank you for those marks. It'll be interesting over the next couple of years.
Carmen, yes.
If I may make one comment, we ask ourselves the question, what's going to be different this time? And we have to ask ourselves that question in governance to say, how are we adding value in a different way? So within the providers themselves, there is strong antibodies against another layer of bureaucracy.
Okay. Barry, Mayor Nuttall.
Yeah, thank you. To follow up on Councillor Hamilton's questions. So is there an opportunity, and I'm asking this question, I guess, I don't know if it's to our public servants at the county or at, through the different healthcare centres, is there an opportunity when it comes to the future and the health team to ensure that the funding that Simcoe County is giving out is to those organizations that are falling under the grander plan of an integrated service model? And if they're stepping outside of that and not willing to cooperate, is that something that we can actually write into the funding agreements with the organizations going forward?
Carmen? Nina, do you want to go ahead? All right.
Sure. Through the chair, thank you for the question, Mayor Nuttall. I think specifically the answer is probably yes, if needed. I do think working with the Ontario Health Teams is we've started to do that work where we're trying to align not only space but common client service. Aurelia is the first hub as opening as we speak that will demonstrate that partnership. I do think moving forward, I would like to see alignment and integration similar to what Councillor Hamilton had shared a bit to make sure that we're effective in the common client service. So like focusing on unattached clients that aren't engaging our health system at all and using probably emergency services and much more inefficient ways to get treatment. Another factor that we're looking into too is a little bit of a layering in, and I think my colleague GM St. Clair can probably share a little bit more about how do we get our local services that offer community-based health. We've integrated them into our communities, like seniors in community housing, but how do we broaden that beyond into our new models of care that we're building?
GM St. Clair, go ahead, add to it.
Thank you, Mr. Chair. I can elaborate on the OHT development because I think what Carmen spoke to today is all about partnership. And at a previous County Council session, staff actually presented a new OHT program by the County of Simcoe. So we are very intentionally and strategically ensuring that we're at the table with, there's 5 OHTs, for example, within the County of Simcoe boundaries, so that we're at the table, we're working with the partners, and as was presented, we'll be part of that governance structure so that we can help stewardship of the funding, not just for our own County of Simcoe funding, but healthcare funding across the entire sector. So we are very invested in this partnership and looking at what is happening with healthcare, not just at the acute care level, but in the community, long-term care, paramedic services across the entire continuum. And we'll be reporting regularly back to County of Simcoe in terms of what are the priorities, what are the developments, and how are we working together to ensure those healthcare dollars are being utilized as effectively and efficiently as possible. So we look forward to continuing this partnership and providing updates to County Council and council members from Aurelia and Barrie.
Supplementary, go ahead.
Yes, please. Just 2 more questions. My follow-up question would be, what would you envision a circumstance funding an organization that's refusing to be part of the local health team? Is there one, or is there not? And so if there isn't a circumstance where we would be funding organizations that refuse to be part of a grander strategy, then let's put it into our funding agreements. And if there is, then let's explain to County Council and this committee what type of circumstance we would fund organizations that are not coming to the table.
Who wants to try that one? Yes, go ahead, GM.
Through your worship, yes, I do think for at least for social and community services, like our social and community investment fund has very specific guidelines on partnership development and being integrated into our strategic plan. So our 10-year affordable housing plan, our children's services plan, our poverty reduction strategy, and our newcomer strategy. So for us, if it doesn't tie to those programs, which those strategies tie to a larger health-based well-being outcomes, then they wouldn't qualify for those fundings. Specifically, if an agency says, like, we are seeking this funding, but we are unwilling or cannot participate in our larger health services, I would consider, like the panel reviewing that would probably consider that as not an effective kind of outcome that we're looking for. So if it's in contradiction to our strategies and in contradiction to our overall approach to well-being, I can't see how an agency would be funded. We could build that into the agreements, but I would probably rather build that into the criteria and guidelines at the moment of application rather than at the time of agreement.
Okay, that makes sense. Back to sorry, I forgot your name, from Aurelia Soldiers Memorial. One of the conversations we're having locally in the city of Barrie and with our partner municipalities around with regards to the RVH is the funding from local municipalities. And, you know, I understand that there's never enough provincial dollars for healthcare. We could give an unlimited budget and we still wouldn't have enough money. At the same time, municipalities are facing the same struggles, right? And so have you as a team been looking at a more integrated approach across all of the municipalities throughout Simcoe County for funding into the capital builds? I think it's 10% or something like that needs to come from local sources. Is there an integrated approach across the county? I know the mayor of Springwater, Oro-Medonte, and a few, maybe Mayor Leduc and others were at a meeting on this, and we're just trying to figure out, you know, some of these municipalities have multiple health centers that they're, you know, responsible for. If I was in Oro-Medonte's shoes, it would be both Aurelia and Barrie. And so, is there a look at or a proposal coming towards, you know, creating a stabilized approach to that across the county?
Yes.
Carmen, go ahead.
So thank you. That is one of the core functions of the alliance. So to avoid the scenario where multiple hospitals are approaching multiple municipalities, as they're served by so many different hospitals for different local and regional programs, what we endeavor to do is have a singular request. All the leaders get together. We all determine based on, and most recently with the $45 million over 15 years, how that allocation takes place. So we meet regularly with Jane's leadership to identify that allocation between facilities. So yes, that is a coordinated approach. Is it enough? It's never enough. I think you pointed that out with cost escalation. However, that is a core principle that we operate within the Simcoe County Hospital Alliance, because it's, and back to your earlier point, we have since learned that our success in proposals is exponentially improved in partnership. So principally, that is the way we've been successful, and we want to continue that, and we want to work together to figure that out. Yes, it can be perceived we are competing with each other. I would argue we are competing with the province. This county is competing with the province. There are hospital projects in Ottawa and in Mississauga that are bigger than all of our projects combined. That is the competition. So we need to be behaving in a way that's collaborative so that we can put our best foot forward to the province and say, here's where the value resides. There's value in partnership, and we have to do an excellent job doing that.
Mr. Warden, I guess my concern related to that is $45 million over 15 years from the county is a drop in the bucket. For us, I think we're looking at somewhere in the neighborhood of $100+ million from the city of Barrie just for the RVH expansions, both the south and north. RVH expansions. And when I look at the data coming in from the RVH, about 50% of the people that visit it, it's actually lower than that. I think it's 46%, and I'm sure Gail will correct me and it's some other number, but it's somewhere in that neighborhood, is coming from outside of the city of Barrie. And we're stepping up just for this one health center with over $100 million. And so I think if it's going to be an integrated, stabilized approach where everybody's funding, there needs to be some equity in terms of those dollars that are coming up.
GM Sinclair.
Thank you, through you, Mr. Chair. This has been a very big topic at the Alliance for quite some time. And the county will be bringing forward a report in May to talk about the long-term financial planning to support our local hospitals. So we will be making some recommendations for council's consideration in terms of looking at developing kind of a needs analysis of all of our hospitals over the long-term 10, 20-year horizon, and bringing back some recommendations in terms of how do we work collaboratively to support the hospitals, recognizing the significant financial constraints that we're all feeling. So we will be bringing back a detailed report for council's consideration, and we look forward to your input.
Carmen.
Thank you, Chair. Really grateful for Jane's support on that initiative. I think it's absolutely critical. The hospitals will also support that with the information we receive from the burden of health disease reports that we receive provincially through the University of Toronto. We can combine all that, and happy to make that a priority item for future updates to the Committee of the Whole.
Okay, do I have any other questions? Great discussion here today. Not seeing any, so thank you, Carmen, and thank you to the rest of the Alliance members that made it here as well and joined us this morning, and for the hard work you do. Thank you.
Thank you, Warden.
Okay, with that, it's still only 10 o'clock. Let's roll into performance management. Chair Cox.
5.1, move in a seconder, please. Moved by Councillor Minisking, second by Deputy Warden Coghlan, that item CCW 2024-115 dated April 30th, 2024 regarding Simcoe County Archives operations in March 2024 be received. Any comments? Seeing none, all in favor? Carried. Thank you.
Thank you, Chair Leduc.
Yes, thank you, Warden. We're at Human Services consent items. We have 4 of them here. 6.1 is a presentation that we have right now. So before I do anything, I'll turn it over to General Manager Mina Fiaz-Bagat to introduce your staff for this presentation.
Thank you, Chair Leduc. This report is demonstrating an update on our Canada-wide Early Learning and Childcare Directed Growth Plan, which is the federal program to subsidize childcare spaces here at the county down to $10 a day. So I'm going to have our Director of Children's Services, Sam Searcher, walk us through the presentation of the 2023 and the 2024 outcomes.
Thank you. Thank you, Your Worship, and Chair Leduc and members of Council for having me today. As GM Fiaz-Bagat had indicated, we wanted to provide a bit of an update of what's going on. We had come to Council in October with our initial plans, and we've had some changes that have occurred in the last few months that we thought was important to share with you. There we go. So the Canada-wide Early Learning and Childcare Program, which I'm going to refer to as CWELC, was announced in 2022 and started on April 1st. In that year, all licensed childcare programs had the opportunity to apply for, to opt in to the program and become part of it. So it's commonly referred to as $10 a day childcare. It's not quite at $10 a day yet. We're at roughly a 52% reduction on fees over what families were previously paying in 2022. The programs that I'm going to be speaking about today with respect to growth are not the ones that originally opted in. It's anything that has happened since that time. At the end of 2022, the Ministry of Education reached out to all municipalities and announced the space allocations that those municipalities could grow in licensed childcare as part of CWELC between the periods of 2022 and 2026. They also provided a draft access and inclusion framework, which prescribed for municipalities what we needed to do to go about determining which areas would be prioritized for additional childcare. So we reported to Council in October with the 8 primary municipalities that we would be starting with as priorities, based on those requirements that we received from the Ministry of Education. So these were the socioeconomic factors that we needed to consider in comparison to the population of children 0 to 5 in each of the areas. In addition to the socioeconomic factors, we also had to look at the provincial access ratio. So the provincial access ratio goal is to reach 37%, which would be 1 affordable childcare space for every 2.7 children. Right now, in the County of Simcoe, we have an access ratio of approximately 23.4%, which is the equivalent of 1 space for every 4.3 children. In order for us to reach that 37% access ratio by the end of, we would require 5,295 new CWELC spaces. When we received our allocation, we received 3,081 spaces for that period of time. So we won't have enough to reach that goal across the entire county, but this is the direction that we're headed. So this was the space allocation and how it was amortized over the period. We have 2 different kinds of spaces. The school-based spaces are spaces that were assigned to capital builds by the Ministry of Education. So any new schools that are going up or schools that have approved expansions that have a childcare built into them, we're required to fund those ones. So those are part of that allocation. The community-based spaces are the spaces that we will focus on in the growth plan. So one thing that I think is really important to share is that other childcare programs or additional childcare programs can continue to open. We're not preventing childcare centers from becoming operational, but we only have a specific amount of funding. The funding is tied to the spaces. So without that funding, that's as much as we can approve for CWELC. Other programs can open, but would be charging market rates, not the reduced rate to families. In the fall of 2023, we did reach out to the Ministry of Education to let them know that we do require additional spaces in order to meet the targets that they're hoping for. At this time, we've not received any additional approval of spaces, but that is our hope, is that over time, as they look at other municipalities who may be underperforming, that they may be able to reallocate spaces. But at this point in time, we have the spaces that are set up in our allocation. So this is what our spaces look like currently. And what is really important to share is that in 2023, originally there were 342 school-based spaces expected to open. We had expected to overachieve our numbers in 2023, which meant that we had to borrow spaces from 2024 in order to fund those spaces. As a result, we weren't able to move forward with approving spaces for 2024. Our hope had been that we would receive additional spaces late in 2023, and so we proceeded with an application process with operators in the hopes that we would get those spaces and be prepared to move quickly when we had limited time towards the end of the year. The 2023 spaces really were made up of 2 key components. We had existing programs that had opted out in that original reach out in 2022, and then opted in at the beginning of 2023. We learned late in the year last year that we would need to include those as part of these growth numbers. In addition, we had significant growth in our licensed home childcare sector, which is something that the ministry has worked to change their processes in order to sort of limit that so that we have some control over that growth moving forward. We then have, after numerous conversations with the province, have received approval to re-amortize the spaces, meaning the spaces from the school capacity that was not completed in 2023 could be reissued to community-based spaces on the provision that going forward we would hold spaces and funding to support those programs when they do become operational. So they expect to come operational in various years between 24 and 26. Based on those changes, we were able to relook at our numbers, and it meant that the 931 really was only an overachievement of 125 spaces. So we did still have to remove those 125 spaces from 2024, but it left us with 651 spaces to approve this year. And to date, we've confirmed 127 school spaces and 515 community spaces, which brings us to 642 in total. So we have 9 remaining to allocate. As part of the approval process and working with the procurement team, we have a two-part application process for childcare operators. They first apply to become pre-qualified as an operator, meaning that they meet all of the ministry required expectations through the Access and Inclusion Framework, and then they can apply for the spaces as they become available. In making our decisions, we looked at their applications, which were scored, and then we also looked at, after removing the school spaces, we then need to look at their auspice, meaning are they a nonprofit operator or a for-profit operator? We have a ministry required or ministry mandated minimum threshold of 71% nonprofit programs that we must meet or exceed by the end of 2026. The applications that we received for childcare, we received over 30 applications in the first round, which equated to 3,395 spaces, which far exceeds our allocation even over the 5 years, let alone just the 1 year. And the majority of them were from commercial or for-profit operators. The other considerations that we looked at were the size of the license, other programs in the area to ensure we weren't destabilizing the system in any way, and if there were underutilized spaces that could be supported for reopening. This is the growth that we have in our 8 targeted priority areas up until 2024. So again, 2022, these are the spaces that were new in addition to those who opted in. You'll see, if I can draw your attention to the licensed home childcare section, there were 147 new licensed home childcare spaces. At that time, those agencies were not required to report to us the location of those homes. So we have them by the location of the head office, but not the home specifically. Moving forward into 23, you won't see anything there because they then had to report by area, and they are broken down by the applicable municipalities where they opened. We've allocated 120 for home childcare in 2024, and by the end of the year, they will have reported to us which locations they're in so that we can, again, report them by municipality. You can also see, if I can draw your attention to the net new spaces. So those programs that were not brand new programs, but that opted in 2023, were spaces that we then had to include as growth, but they're not technically net new childcare spaces. So in the end, we will have 1,532 net new childcare spaces by the end of this year, 1,928 new CWELC spaces. So for next steps, we'll be continuing to work with the Ministry of Education to promote the need for additional childcare spaces in Simcoe County. We are going to look at our existing funding envelope to determine whether or not there are ways that we can advance any of the 2025 spaces using our existing funding. We're also going to be updating all of our data analysis. So the original data is based on census information, and when we're looking at a population of children 0 to 5, if we wait the 5 years for the next census, that data is going to be out of date. So we're looking at other data options to gather that information that are more up to date. And then as we move forward, future calls for childcare spaces will be specific to areas that we are targeting. And if a municipality has met or achieved that 37% access ratio, then they will drop off the priority list and another municipality will move on to the priority list. So that was just a very quick overview. And I will turn it back to you, Chair.
All right. Thank you very much for that presentation. Any further questions on the presentation? Councillor Hamlin.
Thank you for that. I guess as Mayor of Collingwood, I couldn't help but notice all the zeros in the chart relating to Collingwood. I'm just wondering if you could explain what's going on with that. Thank you.
Go ahead.
Thank you. Through the chair, so in Collingwood, we have it, which I should say not just Collingwood specific, but countywide. We are limited to where childcare operators choose to set up shop. for lack of a better term. At this point in time, we don't have any childcare operators who have come forward with a proposal or plan for Collingwood. And so for those areas that are like that, there are a few. Collingwood, Midland, Penetanguishene are all sort of on our radar as areas that we may need to go out to operators to seek interest, to see if we can promote interest in order to move that direction.
Follow up?
Yeah, thank you for that answer. Yeah, because I do hear from parents that there's a dire need for daycare spaces. So if there's anything you think can be done at the municipal level, I'd be happy to have a further discussion with you. Thank you.
All right, thank you for those questions. Councillor Evans and then Councillor Scott.
Thank you, Chair. I appreciate that. Thank you for the presentation. Very interesting. I'm from the township of Tiny. We're one of the unnamed up there, and I just wanted to give a little background and ask a question. We run a very successful summer recreation program in the township of Tiny, and we have a lot of people that want to get into the program. Unfortunately, we're not always able to bring all the kids in. Just to give you an idea of numbers, in a day and a half, we went through 935 applications, and we still have 1,400 total. So I guess my comment is I understand this childcare, but to the need for summer and holiday, so our residents can, unfortunately find something for their children to do while they do go to work. And if there's any opportunities for us moving forward to be able to look at programs that are obviously very, very successful, that benefit not just the township of Tiny, of course, but North Simcoe, and I'm sure there's other areas in the township or the county as well that, as a cumulative effort, that we could work towards to provide opportunities, primarily for the summer, but certainly for Christmas time and other areas as well that we need in the community. So thanks again for the presentation, and if you have anything to add on that, I'd be very appreciative. Thank you.
Thank you for that. I now have Councillor Scott.
Thank you. So I never want to criticize when we're able to make progress, and as you've mentioned, we're making progress, but we're not going to achieve the goal. So I suppose my question would just be, in the case of Bradford, we're receiving, I think, the third most childcare spaces, but I'd be curious to know how far away we are from the goal. And just as added context, we, both as a council and in partnership with our school trustees, have been sounding the alarm on the desperate need we have, not only for childcare, but also for at least 3 new elementary schools and a new high school. We have a meeting on the books with Education Minister Stephen Lecce later this month, as well as our MPP, and the rapid growth we're seeing, particularly the fact that we're seeing rapid growth of youth. We're, I believe, the youngest municipality in the county, and we have something like 10 or 11% of our population in childcare age alone, not to mention elementary and secondary. So the need is critical. We have dozens of portables, including at both of our high schools, which I certainly don't recall being acceptable when I was a student at Bradford High, for example. But this is all just to say making progress is good, and we certainly welcome that, but how far off are we from the goal, whether county-wide or if you could get more granular and say Bradford specifically?
I'll turn it over to Mina for that reply.
Through the chair. A couple things. Absolutely agree that there is a delta. Director Zurcher had mentioned the delta is about 2,000 spaces that were not allocated. So while the county of Simcoe received the 3rd highest allocation across the 47 service managers, we still believe it's about 2,000 short of what the provincial average is set by the guideline. We're working on a dashboard that hopefully will launch later this year. We mentioned it in the report, that will give a breakdown member municipalities and the 2 separated cities on how close are they to the provincial average. One thing that we did successfully last year is we focused on the fact that childcare is an economic driver with the ministry, and we really pressed that in our different delegations with the minister, and really focused on the labor force gap. We thought the precursor, and we know this to be true, for why we can't stand up spaces or have new providers throw in their hat in the ring to apply to set up new spaces is because of the labor shortage that they're struggling with as they compete with childcare providers that work out of the education system. This past year, we were able to get a new funding model launched by the ministry to help close that gap in pay disparity. So we think that first predecessor or precursor to growth is kind of checked off, and we're going to roll out that funding program that will help them as employers employ more stable staffing models. The second part of that growth strategy is then going back now, building off that first advocacy campaign last year. And we're happy to join any town's advocacy campaigns to discuss how we can then get those 2,000 and so additional spaces. We've been asking for in-year borrowing, basically borrowing from future years, borrowing from under-accomplished education sector spaces, and from other municipalities who are underperforming. But that still doesn't solve the 2,000 delta gap, so we're hoping this year's focus on our advocacy is to get us to that 2,000. But we will share the disparity, like the town-by-town disparity and how close we are to accomplishing it. Because as to what we shared in the presentation, if a town accomplishes that 37% target, then they're no longer prioritized. And then we go to a town that's underperforming to try to get space there.
Okay. Follow up?
Yeah, thank you. I appreciate that answer. It makes good sense. I'll just add, when you were speaking about the economic indicators of childcare, and I would say the care economy in general, we're now in a position where most of the job creation conversations we have, they're not just asking about land price anymore. They're not asking about transit, childcare, and how we're going to house our workers. And so when we speak about the labor shortage, part of that is parents who would happily enter the workforce, but it costs more to get good care for their children during business hours. So this is a huge economic issue as well as a social care issue. There was a mention to this already. So in Bradford, for example, I think we've increased our summer camp spots, for instance, by about 120%, and even more for special needs children. And that fills a gap for the 2 months of the summer with childcare, library programs and such like that as well. But we, again, just desperately need childcare, and we desperately need more school spaces in general as well. So thank you for the work you're doing on this. We'll certainly, I said this at a federal announcement about Lake Simcoe about a month ago, we welcome the funding and we look forward to more.
Good comments, thank you. I now have Councillor Fryer. Anybody else after?
Thank you, Chair Leduc. And actually, my question was going to be very similar to Mayor Hamlin's, but I will just take the opportunity then. I had read the report, and I had some comfort that for those places that hadn't received any spaces yet, they'd be prioritized. But I also want to include my appreciation to staff for trying to find interest within our community, and hopefully that'll come to fruition, and we'll be able to get some spaces in there. Thank you.
Thank you for that. Councillor Gordon.
Thank you through your, Mr. Chair. I can echo that sentiment. Even in our community, we have we have obviously childcare providers. A lot of people are taking kids into their homes in their basement, supplementing their income, paying their mortgage by looking after kids. But we also are blessed with a couple of really good accredited childcare centers with educational components, and one of them is brand new and state of the art. And I don't think they were able to secure any funding at all for subsidies. So it's pay to keep your kids there for the wealthy in our community, which we do have in North Simcoe. But there's a humongous gap, as we all know, between the wealthy and the people that are literally living paycheck or subsidy to subsidy. And it's those folks, actually the majority of our community, who lack the ability to have their kids in daycare now. Because I look at that number, what is it, 10 seats for Midland? I can't help but have my Midland hat on when I'm sitting here. I'm looking at hundreds of seats in other municipalities. There's a desperate need. And, we've had some dialogue with this new provider in our community, desperately hoping that they would have made the cut for some more funding. It didn't pan out. I understand the pressures and the competing interests. But there are, in all of our communities, these centers that are opening up or trying to open up that want to provide a really top quality service. Not that the folks in their basements aren't, but these are real places with people with education and equipment and insurance that can only right now cater to the folks that have the capacity to pay for the kids to be looked after, and that's not really the demographic that has the most need. So I can understand entirely the pressures we're under, and there's only so much money, and you can only squeeze the province for so much, and it's flow through. But just echoing the concerns, I think, of all the municipalities, probably the smaller ones in North Simcoe that are really feeling this. So appreciate any effort, and if there's anything this House can do, or members of this House individually in their community to help you with the lobby, don't hesitate to reach out. I don't mind using what little influence I have to try and add my voice to the chorus to get more funding and release it to the smalls in North Simcoe. So thank you very much.
Yes, and thank you for those comments, Councillor. And it is a tough one. I can tell you that our staff, I thank Samantha and General Manager Fayez-Baguette for doing this and really going out and trying to get as much as we can for childcare spaces. We all need them. There's no ifs, ands, or buts. We all need them. And when you look at the census, the 5,295, that census in 2021, we can tell that number is even higher in 2024. So our staff have done a great job. We'll continue to fight for those childcare spaces, and we'll hopefully get that delivered to every community because we all need it. It is about our children, about our educational system and our healthcare system. So this is all integrated into that system. So look forward to seeing more spaces. Thank you, Samantha. Thank you, General Manager Fayez-Baguette, and thank you, Sonia, or I think it's Tanya or Sonia. Sorry. Tanya. Thank you to all of them for doing what they did. So if there's no further questions, we'll move on. I know we've got other consent items in this agenda. So thank you, Samantha, very much for that. We have also then, we have 6.2, the Immigration, Refugees and Citizenship Canada. So there's a couple of funding applications in there. The county has applied 2 applications in there. One under the Local Immigration Partnership for $2.9 million over 5 years, and the other one over the RAP, which is a Resettlement Assistance Program, up to $12.9 million over 5 years. There's also then the Emergency Preparedness Week. That's a great guide there. The guides in there are great. You can pass those kits out or pass that guide on to others in our community to prepare for anything like that. And then we also have the 6.4, which is the Community Simcoe Paramedics Special Events Bicycle Deployment. A great new initiative. The bicycles, they have 2 coming, so they're doing 6 large events and 20 small ones throughout our region, so nice to see that. And then we have the Affordable Housing Development Partnership call for proposal and request for information. I think that was well received. There was 14 out there proposals, 11 from our municipalities out of 7 municipalities, so the report was great. Good partnership there, a good call for everybody, and good to see 14 applications there, so you can see the need. I have a comment from Councillor Cox.
Yeah, through the chair to Mina. I had talked to Mina before the meeting, and in the Aurelia Chamber Advocacy Committee is looking for information on housing, also on affordable housing and different numbers for the municipalities. And I was just wondering, you had said to pop that question up here, if you could give us a bit more information, Mia, a bit more information on that. Thank you.
Through the chair. Yes, in the report we talk about our 10-year affordable housing and homelessness strategy and how it's been informed by those 3 calls. Part of that strategy is to look at all different types of housing for the next 10 years, including labor force housing. And you know, throughout this process of requesting proposals, we've received proposals from private developers and private labor industries or employers, you know, asking to partner in developing specific based housing for labor force, particularly in the health sector and in the manufacturing sector. So you'll see in the 10-year affordable housing homelessness strategy, once it's ready for publication, that covered in a section of how in the County Simcoe we are going to try to focus on affordable housing, but affordable housing for specific labor sectors. The other thing too is the province has put a slowdown or stop on our 10-year affordable homelessness and housing strategy because they're going to introduce new guidelines for that 10-year plan. And while we await the guidelines, we suspect they will also kind of cover that as a requirement of the plan, is to include all different types of housing. I know there's been talk of student housing and retirement homes, but I suspect there also will be specific labor force housing as well in their guidelines. So while we prepare to publish and pull together the report and kind of announce the development component of that strategy, you'll start to see that criteria included in it. And then finally, in terms of affordability for labor force, we are working on a dashboard that demonstrates each of the member municipalities' average market rent, true average market rent, so that you can track the level of affordability happening in each community, as well as in the two separated cities. And what we're doing is scraping the data that's published already to come up with a real average, not the CMHA, sorry, the CMHC market rent average that we use. This is the one that's the pragmatic number that people actually rely on to find housing. So those are coming, so that will help inform the need as well.
Thank you very much.
Excellent. Would anybody like Councillor Snell?
Thank you, Chair Leduc. I just wanted to bring us back to 6.3, if I could, the Emergency Preparedness Week. If there were no further questions on the currently discussed item of 6.5.
Yeah, if you want to just talk about 6.3, if you go ahead.
Okay, great. Thank you. Just wanted to draw attention to two items. This Saturday, May 4th, from 10 until 2, Wasaga Beach is proud to be hosting a joint emergency field exercise. There'll be 200 participants between the Canadian Armed Forces, Paramedic Services, County of Simcoe Emergency Management, OPP, Georgian-based Search and Rescue, and the Wasaga Beach Fire Department. We've all received an invitation, and if you wanted to join us on hand at 2 o'clock to greet and get a tour of the venue, that would be fantastic. And I just wanted to call attention to thank the staff for the great work in providing the extensive emergency preparedness guide that's in this report. I think that's a great resource and tool for our communities, and definitely encourage all the residents to print it off and have it on hand to help prepare for your plan. Thank you.
Yes, thank you for reminding us of that. Great that there's emergency preparedness coming up, and that guide is fantastic. I agree with you. Everybody should print it off. I gave it to my daughter for her children to prepare a guide for her house. So great guide. Further comments or questions on any of these items? Would anybody like something pulled? Councillor Hamlin.
Hi, thank you. With respect to the report on the paramedics special event bicycle deployment, I thought that was an awesome, move forward by our paramedic service. And I was just wondering, is there a process available if a community wants to make it known that there's a special large gathering happening and that possibly, make a request for this kind of service? Thank you.
I'll ask our General Manager, Jane Sinclair, to comment to that.
Thank you, Mr. Chair. Thank you for those comments and the question specifically. We always appreciate knowing about events coming up so that we can plan our resources accordingly. I'll look to our Director-in-Chief of Paramedic Services in terms of who to contact, but we do, from any municipality, if you know there are events planning in the works, we really appreciate that information in advance.
Through the chair. Thank you for the question. You actually can go on our Simcoe County webpage, and under events, there's a form that you can fill out, and it allows us to know kind of what the event is, what you're requiring from us. Is it just, do you just want like a community engagement, or do you need medical support? And then we can, once we establish those relationships with you, we also tend to have these year over year. So something like Boots and Hearts that's happening at Burroughs Creek, they reach out to us directly once we've established that relationship, or Mariposa, we just kind of continue that relationship with them. So if you go through the events page, we'll be happy to get back to you and assist you with any planning.
That's awesome. Thanks.
Yes, excellent for that question, and hopefully our event staff that works for our events are out there tapping into the county for sure for those services. But it's great to see that deployment of the bicycles. I think that's a great initiative moving forward. Gets to us and those large events. I'm thinking of Carrot Fest. I'm thinking, how does people get through Carrot Fest? Because it's downtown Bradford. It's in a street, and I think those bikes are fantastic. That's a great idea to move through that traffic or those folks a lot quicker to get to these emergencies. So, okay, further comments or questions on any of these consent items? All right, seeing none, so I'm going to ask that it's moved by Councillor Scott, the alternate Councillor Scott, and I'll ask the other alternate Councillor Belanger to second the consent items. Great, so I have the following consent items have been given due consideration, be received. All in favor? Carried, thank you. We are on to 6.5. That is CCW 2024-093 Affordable Housing Development Partnership. Oh, no, sorry, did that. Sorry, I got confused here. 7, we're on to 7, Human Services Social Housing. We have 7.1, Redwood Park Communities Request for Reimbursement. Any questions or comments with this one? Councillor Laux.
Thank you, through the chair. I was just wondering, in the report there it states that we're going to share the refund of 177. I was wondering how that was actually divided up and what share of will the county be providing of that amount.
Okay, I will turn that to our General Manager, Faiz Bagat. Can you comment on that?
Through the chair, so this is not a refund. This is an overspend reimbursement for costs. So this was the modular add-on second stage of a development for our supportive housing units. And I'll ask maybe Director Spiewak to speak to the specifics of the cost overrun and then why they came up with that number.
Yeah, thank you, Mina, and through the chair. Yeah, so unfortunately, this is one of the modular builds that did advance right through the pandemic when it was put in, and so they were during mid-construction hit with some inflation. So looking at the cost overruns, they did provide all their financials to us. This was a third-party build, so again through Redwood Community Homes, so separate from a county build. However, they're hit with the same pressures that we are on all of our construction projects. So the overrun is about 10 to 12%, and through the pandemic, that's not unreasonable. And they did have their financial statements to back that up, and we suggested then approving. So this, as the report states, comes out of reserve, and it's also a cost shared with our separated cities. So the proportion share through the municipal facilities agreement applies on this particular cost. So the county share comes out of reserve, and then the cities will be accountable for their share.
Okay, thank you. Just a follow-up.
Yep.
Just specifically, though, county share will be 1/3, like 59,000 of the 177, or I'm just wondering how it's divided up and who's paying how much.
Through the chair, for housing services, the contribution agreement is structured that the separated city of Aurelia pays around about approximately 5%. That's their contribution. The city of Barrie's contribution is approximately 26%, 25.5%, and then the remainder is so it's about a 70-30 split if you look at it county versus the two separated cities.
Okay, thank you.
Okay, perfect. All right, so I'm going to ask if Mayor Nutt will move this, seconded by Councillor Fowler. I just picked names. I'm sorry, I just picked names to go out there and keep people alive and awake. So that